I think I might have ADHD and I would like to pursue a diagnosis. How do I prepare and what should I expect? So, just a little bit of backstory. I was diagnosed with ADHD when I was 29, and the diagnosis honestly changed my life. I wasn't even looking for a diagnosis at that point. My psychiatrist just happened to pick up on something I said, and then she referred me to have an assessment. And if I were to seek out an ADHD assessment today, starting completely from scratch, this is what I would do. First, you want to take an inventory of your struggles. I don't mean just think about it, but I mean write things down. This will be your starting point to being able to express your concerns. So you want to look back on your life. What did you experience? What do you struggle with? What are the signs and symptoms that really stand out to you, and how are they affecting your life? You want to get that down somewhere that is easy to reference and easy to share with the person who's going to be assessing you. You can also take a few quizzes. There are a ton of online screening quizzes for ADHD, and obviously, a quiz online is not going to be sufficient for a diagnosis. However, it can give you some sort of sign or signal that you might want to look into this further. And if you do decide to take some of these quizzes, those results can be valuable information for you and for your assessor. Make sure you've done some research on the signs and symptoms of ADHD, especially in different types of people. And obviously, if you are not a doctor or a healthcare provider, you're not going to be able to get an official diagnosis from just research. However, it can help you get a better understanding of how this might be affecting you, and you can communicate your concerns so much better. Know what you want to say. So, one of the things that a lot of us with ADHD struggle with is expressing ourselves. And it can be really difficult for us to get our thoughts together on the spot. So, just having a general idea of what you want to share and say to the person who is assessing you can make so much of a difference, even if it's just little bullet points of reminders of things you want to bring up. You don't have to have a whole script ready, but just having something ready that is really easy to pull out and reference during your appointment, and knowing what you want to say is just really going to help you get your point across. And it'll make you feel a lot more sure of yourself during your visit. First is someone just throwing a whole bunch of questions at you and you haven't really gotten it together to be able to answer them clearly. It can make you feel discouraged, and for assessors who lack nuance, they may be less likely to listen to you. Once again, being able to advocate for yourself is extremely important, and one thing that really helps with that is being able to express confidence. So you've gotten your thoughts together, you've got an idea of what you want to say, you've gotten your research together, maybe you've taken some quizzes. Now you want to go ahead and look for a provider who can carry out this ADHD assessment for you. From my personal experience, the best way to get someone who's going to take you seriously and be able to read between the lines and notice little nuances is probably going to be someone who specializes in ADHD, specifically adult ADHD or ADHD in women, or seeking out a psychiatry practice that serves a lot of people with ADHD and has that like listed as one of their big specialties. You can also just fire up Google and type in ADHD assessments for adults near me or something, or your state, and some options should pop up. And these assessments can be done in person or remotely. So if you live in an area where you're not really sure you're going to be able to find a place near you that specializes in ADHD, you can still use a telehealth option because a lot of times they will cover multiple cities within your entire state. So that can make accessing this a little easier for you. Unfortunately, some places where you feel like you'll be taken seriously at may not take your insurance, or some of these places may not take insurance at all. So there may be instances where you need to pay for your assessment out of pocket. If that is the case, you can always ask for some sort of payment plan or some sort of sliding scale option. It's better to just ask and see what they have available than to delay your assessment for another year or so. Also, I do want to say that going through these steps to find a practitioner or a doctor who seems to specialize in ADHD, it doesn't necessarily guarantee that you will absolutely leave with a diagnosis, but I do believe it is more likely that you will probably get some sort of clear answer, or you'll leave feeling a bit more understood. Once you find your provider, you will want to go ahead and set up your appointment. So before my assessment, I was given a quiz, like online quiz to take from the provider. So just expect that, take your quiz. Also, if you have any comments or anything, you have trouble answering a question one way, you can always write comments or clarify or bring up those clarifying questions at your actual appointment. And also, before your appointment, you want to gather the results of your quizzes, any notes that you took, and also the stuff that I mentioned earlier about how your symptoms or potential signs of ADHD have affected your life and how they are continuing to affect you. Also, try to gather any sort of feedback you might have received in the past, like when you were a child. That could be from teachers, maybe some family members, friends, or just general comments that you received a lot in your life, but that you didn't know were actually signs. For example, you might have experienced a lot of people telling you that you don't seem to be focusing or paying attention when they're trying to talk to you. Make sure you have that noted. And of course, you can also prepare questions for your provider if you have any. So that leaves us with the actual appointment. So at my assessment, the first thing my provider asked me was, hey, just give me a general overview of your life and the things you've struggled with that could line up with ADHD. Like, what have your experiences been? What are some things that you find difficult or challenging to do? And then after that, she, reviewed the quizzes that I had filled out for her, and she pretty much diagnosed me on the spot, to be honest. And I think obviously that's mainly because she was the one who suggested the assessment in the first place based on something I had said to her previously. Obviously, if you're seeing someone who you have never spoken to before, who knows nothing about you, then this process might go a little bit differently. So just keep that in mind. I also want to stress, just as a part of self-advocacy, you want to make sure that you share the information that you've personally gathered about yourself, the stuff that you took the time to note about yourself and your life, and also ask your questions. Don't allow yourself to be brushed off. If your assessment is an hour and they talked to you for 5 minutes and said, oh, you don't have ADHD, make sure you speak up for yourself and take up that time that you paid for and get your point across. Their job is to listen to you and point you in the best direction for you. So make sure that happens. And once again, if you are seeing someone who specializes in adult ADHD, odds are you will get someone who's going to actually listen to you, be affirming, and take you seriously. It's not a guarantee, but I do believe that it'll make it a lot easier to get the help that you need. And I'm not a doctor. Obviously, I can't diagnose someone, and I'm not going to necessarily jump to the conclusion that just because someone has certain signs, they definitely have ADHD, because it's just not my place to do that. However, if you feel like there's just something more to it, something more is wrong, and you feel like you were not listened to, or you just were not being taken seriously or really seen, you have the right to seek a second opinion or even a third opinion, because sometimes people do seek an assessment and they're told that they don't have that, and then they suffer for God knows how many years without a diagnosis. And then they get diagnosed later on by someone who really knows about ADHD in adults, and they get the appropriate treatment from there. If you're not satisfied the first time, don't just believe what you're told. If it does not feel right to you, do something about it. Okay, so now you've completed your assessment. Let's say that you did receive a diagnosis. Congratulations for making it that far. It will be the beginning of a very challenging but rewarding road to know what is happening with you and being able to take control of your life in a way that works for you and not the way that works for neurotypicals. If you receive your diagnosis, you will definitely look back on your life and realize, oh my God, this all made sense. You might also experience a lot of negative emotions like anger because you were missed when you may have been showing some pretty obvious signs. You might experience grief or sadness. All of that is normal. So just be prepared for that. But yeah, aside from that, after you receive your diagnosis, you will most likely be started on some sort of treatment plan. So that could be medication, that could be therapy. So for me, my first course of action was getting on a stimulant. I was already in therapy, so that wasn't part of the additional plan, but what I needed was medication. So that's what happened for me. Whatever is best for you is something you can work out with your healthcare provider. They also might share some support groups and resources with you. If they don't, you can always ask for that later, and you can search for some yourself too. You also might find some books that'll be helpful for you. Basically, you will start to learn how to operate a lot differently than you've been operating before. Of course, you may have created some coping mechanisms naturally yourself that you didn't know were coping mechanisms that you created because of ADHD. But even if you already have ways that you've managed to function, since you have the clarity now and the diagnosis now, you will be better equipped to use strategies, suggestions, and information that is better suited to you. Thank you so much for watching. And if you are someone who believes you may have ADHD and you're seeking a diagnosis, I really do hope that this video was helpful for you. I've also linked some quizzes and some resources that I found helpful in the description below, so be sure to check that out. Also, don't forget to like this video, leave a comment, and subscribe. I'm going to make a video soon about what to do after an ADHD diagnosis, so stay tuned for that.